Good morning, everyone.
Good morning.
On behalf of Children and Adult and Arthritis and Osteoporosis Center, we humbly thank you all for coming out this morning, this early Saturday morning. This program is sponsored by IGMA, I Give Myself Away Incorporated, which is based on Dr. Paul's son, who transitioned several years ago, and now there's a scholarship fund out for him. So this program that we bring to you today signifies his life and the story that he told. Again, we appreciate you all coming out. I am Falanda Maddox. I am Executive Director for Children, Adult, and Arthritis and Osteoporosis Center. From this point on, I will call this CAAOC because this is such a long name. Today we have Children, Adult, Arthritis and Osteoporosis Re.P.A.I.R Day. Arthritis affects a number of things in the body. It's a debilitating disease that's affecting well over 50 million adults and well over 300,000 children. CDC says within the next 20 years that this will increase by 20 million adults that will be affected, and more than 50,000 children, more children will be affected. So this disease is on the rise. Today you'll hear from several speakers who will speak in regards to some of the different types of arthritis. You'll hear from some of the people who would have personal experience with different types of arthritis. So we bring you a wealth of information on today. Do bear with us. We will have to deviate from our program just a little bit. Ms. Booker is not here. She emailed me and said she had death in the family. The Arthritis Foundation will not be here because their member came down with the flu. So just bear with us for just a little bit. At this time, we're going to open up with a prayer, and I'm going to ask my better half, Thomas, to come up and open up with a prayer for us.
Let us pray. Lord, we thank you for allowing us this morning to wake up. Lord, we thank you for your goodness. We thank you for all you've done for us. Lord, we ask you to forgive us for our sin. We forgive those who have sinned against us. Lord, open our minds that we may understand some of the information and education that we have in store for us, Lord. And we just ask you to continue to have grace and mercy on our lives. In Jesus' name, amen.
At this time, we'll have the presentation of the proclamation by Mr. David Burkette, City Councilman from Montgomery, Alabama.
Good morning, everybody. I first want to just take this time to say that I am very thrilled to be here. And as I look around, every table is not filled, but every heart is filled that's in here. And it's not the size of the crowd, it's who's in here that counts. Every one of us in here could sow a seed and go out in the community and let everybody know that this is what we're doing, and everybody needs to have an understanding on what's going on. Once we get that out there, it'll be to the point where we are at capacity, and that's what I look for, because I know that's the kind of work God does. But on the behalf of the city of Montgomery and the office of the mayor and 9 city council members, I really, really am delightful that Dr. Paul had called and then insist, because the mayor could not be here. The second in command, she could not be here. Once I got the call to ask, well, they actually sent an email out, and I think I was pretty much the only one that responded when they asked if I could. And I just want to let everybody know that I am delightful here. I'm welcome here, and you're stuck with me. So I'm going to ask my wife to come up. And, well, at least she called on the right person. She said, oh, Lord. Come on.
You better hope I can see it. I see it's so small. It's really small.
That is the problem with me.
Ooh, it is small. Okay, whereas the mission of the Children and Adult Arthritis and Osteoporosis Center and IGMA Incorporated is prevent and alleviate disability related to arthritis, osteoporosis, autoimmune diseases. They are committed to help lessen the rheumatology crisis. And whereas the center's goal is to reach out to healthcare professionals, including physicians, nurse practitioners, physician assistants, nurses, social workers, and social occupational therapists by providing educational opportunities to the field of rheumatology, and whereas through outreach, nurse practitioners and physician assistants are being made aware of the need and opportunities in rheumatology. A significant difference can and will be made in the supply and demand of rheumatology caregivers, and whereas arthritis is the #1 cause of disability in Alabama, costing taxpayers more than $2.5 billion annually. There are approximately 60 rheumatologists in Alabama to care for the nearly 1.7 million children and adults, 1 in 4, with doctor-diagnosed arthritis, and whereas there are more than 100 different types of arthritis: rheumatoid arthritis, fibromyalgia, gout, and lupus. Although most people are aware of the significant negative influence of diabetes, high blood pressure, cancer, and heart disease, most are not aware that arthritis is the leading cause of disability. And whereas on March 18, 2017, the 10th annual Children and Adult Arthritis and Osteoporosis Re.P.A.I.R. Day, Reach Out Prevention Awareness Intervention Recovery, will be presented by Children and Adult Arthritis and Osteoporosis Center, a program of IGMA Incorporated, and whereas the objectives of this program are to decrease pain and suffering due to arthritis, assist with early diagnosis and treatment of arthritis through individual education, provide educational seminars and workshops to healthcare professionals, provide educational seminars to the public. Now, therefore, I'm not Todd Strange, Mayor of Montgomery, Alabama, but I do hereby proclaim March 18, 2017 as Arthritis and Osteoporosis Re.P.A.I.R. Day. Here under the seal of Todd Strange, Montgomery, Mayor of Montgomery, Alabama. And
Well, that's what 40 years together do for you. It'll bring you together. And besides, she said that she had contacts on, so her contacts are stronger than my glasses on that. But it is extremely little writing, on here. But I give praise to God that I was bailed out. You see, God is always on time. So I had somebody to read for me on that. But again, on the behalf of the city council and all, and the mayor, we are very delightful partners with this Arthritis Foundation. And I just look forward to coming in. And do not shy away from calling me, because it doesn't matter what I have to do. It's what I got to do, and this is something that I got to do. So y'all can call on me at any time. Thank you.
Thank you.
Before you leave,
Councilman Burkette, as a token of our appreciation, we'd just like to thank you for coming out, support us, read the proclamation. So we have a token. I know you have a better half, so I know we might need to present that to her, and then she'll just
would you
share
come
with
and
you.
take a picture? Take a picture with us. Also, you want to say happy birthday to him. He's got that beautiful 6-0. I seen that 5 years ago. Okay.
yeah.
So, Dennis, you take a picture with him, okay? We also have a certificate for you, and they are getting ready to give that to you, okay? Let's give him a hand again.
Thank you all. Okay, and lastly, I do want to say that I have 4 other engagements two this morning and two this evening. Well, one this afternoon and two this evening. But it's, like I said, this is where I end up at. This is where I wanted to be. And like I said, my motto is, it's not what I want to do, it's what I got to do. And that with that note, I would just say, I thank you all very much on this. And let's get out in the community and make certain that we invite somebody, who invites somebody, then they invite somebody. Therefore, we'll have a coalition. But then again, we do have the right people here. And we all have God's will, and it will be done. Okay, thank you.
Thank you, Councilman Burkette. Just kind of piggyback off what he said. Please invite someone. I'm praying that everyone here hears some information that you can take back and be able to share among your family, your friends, your church members, anybody in the community. Because as you hear today, any number of these diseases can affect you or someone, and it will affect someone that you know. And right now, I'm sure that someone that you know is suffering from some debilitating disease affected by arthritis. There are over 100 types of arthritis, and there's many different forms of autoimmune diseases, like lupus. That's in the black race, lupus is very common. So you may not be able to tell a person has lupus. You may not even be able to tell a person has arthritis. And the thing about arthritis, what people don't know, it takes a while to diagnose because it mimics so many other it mimics so many other diseases. So it takes probably sometimes years to diagnose arthritis. So we need to have many more of these events so people will know. So you can learn what the signs and the symptoms are, and then you can go back and you can talk to your doctor. And that's one of the things that we don't do. As a nurse, you need to have a list of questions when you go to your doctor. You know your body. You advocate for your body. You have doctors that will brush you off and say it's all in your mind, but that's not necessarily so. You know your body. So you advocate for yourself. You advocate for your mom, your dad, your children. You advocate for them. When you go to that doctor, you have them listen to you. You're paying them. So they should take time to listen to you. If they don't, get you another doctor.
Excuse me, Ms. Maddox. If we would, we have a presentation to him as well, if you don't mind. And we want to give you these things. This is Mrs. Joyce. Everybody know her. And also, our office manager and Ms. Maddox, her program. But we would be remiss. They took 2 minutes to go and put this together for you right quick, all right? So we give honor where honor is what? Due. So with that, Ms. Maddox, if you would come up again where you can present this to him, and we'll stand on this side of him, okay, with these 2 fine ladies. They get things done in a bat of eye, I'll tell you that now. Behind every great man is a woman, and behind every great woman is a what? A man. All right, please, come on in.
All right, Councilman Burkette. A certificate of participation. David Burkette is thanked for their phenomenal participation on Children and Adult Arthritis Repair Day. Presented by Dr. William D. Paul, Church on the Road, on this day, March 18, 2017.
Thank you. And thank you again, sir. We are okay, thanks again. Appreciate you. Okay.
So once again, thank you, Councilman Burkette. I know you do have another engagement. We appreciate you coming out. Like I said, we will deviate from the program just a little bit at this time. We're going to show our video on gout. What you see here is Dr. Adam Dooley. He actually spoke at one of the events that we had in Opelika last year. You'll see it's his first annual, but what we intend to do is set this up with different organizations. Like from here, we'll come back here on May 27th, but we also go to Columbus. And when we go to different areas, we unite with a partner there, group or another organization, nonprofit organization, who will help us set up in that area. They have contacts. So our goal is to go from one area to the other, one city, one state, one county, just to get this out, make this contagious. Kind of like what I said before, like a fire. we wanted to take the flames to burn, and we want to see more of us at these events, because these diseases affect us mostly. You realize that as far as a lot of people know with the insurance, right now that's kind of touch and go. But a lot of African Americans are uninsured right now, even with the Obamacare out there or the Affordable Care Act. A lot of us still remain uninsured, so we don't go to the doctor. What I did notice though, as far as being in the healthcare, once the Affordable Care Act came out, we began to see a lot of different patients. So it did some good. It did a lot of good. And once those patients came in, they had been sick for a long time, because they ended up, it wasn't a short stay. They were being diagnosed with anything from cancer to arthritis to other things. They needed surgery. So the Affordable Care Act has made a tremendous difference in a lot. Martine is a nurse. She works directly on the floor. So she can she can also tell you a lot of these patients had heart conditions, congestive heart failure. They come in, having MIs. So the Affordable Care Act has made a huge impact. When I worked on the floor years ago, we used to see the same patients. We called them what is those patients we see over and over? Recurrent patient. But then when the Affordable Care Act came out, then we began to see different patients. And the hospitals are staying full now, whereas our hospital predicted that they started cutting back on FTE, full-time employees. And they said over the years that due to the insurance and regulations and all this, that the hospitals will be decreased, so they started cutting back on staff. Well, that's kind of backfired on them, because now we have more patients than we do staff. Because not only did we not lose patients, we gained patients. So our hospital, and one of the areas I work at in the hospital is called bed control. I'm the nurse. I'm responsible for transfers we serve as 5 different outlying communities, from Wedowee to Lake Martin, Ellick City, all that area. We get patients as far as, we've even had like Dothan. When Montgomery is full, we get there. We constantly get VA calling for admission. So we see a lot of that. We see a lot of traffic coming in. So like I said, the Affordable Care Act has made a difference, and we need to utilize it, take advantage of it, and get everybody in the hospital. You're entitled to an annual visit from your physician every year. Get in there, get checked. We need to make people aware. Get in there and get checked. Find out what's wrong with you before it's too late. You shouldn't come in the hospital and then find out you got 6 weeks to live. That happens a lot because you haven't been to the doctor. We need to educate people. And we're losing too many people to senseless death, things that can be prevented. And we need to let our community know. Get insured, get checked out, go to the doctor, get your blood drawn, just listen. So at this time, we're going to go ahead and go ahead with our video on gout. Like I said, the doctor that you will be seeing will be Dr. Adam Dooley. He's an orthopedic doctor at East Alabama Medical Center, and he had just come on last year. So
the next speaker we have on agenda is Dr. Adam C. Dooley. He'll be bringing you a presentation on gout. Dr. Dooley has a BS from UAB in biology. He have his MD from the University of Alabama of Medicine. He did residency in orthopedic surgery, University of Alabama for Medical Science. Also did a fellowship in sports medicine and arthroscopy, Mississippi Sports Medicine, Tulane Institute of Sports Medicine. The next speaker will be Dr. Dooley.
How are you? I'm Adam Dooley. Again, she kind of went through my training and where I've been. I'm a new orthopedic surgeon at the orthopedic clinic with Dr. Shields, Jones, Trent Wilson, and Ryan Palmer. My first day of work was yesterday, so I'm not... Thank you so much for having me and allowing me to speak to you guys today. I'll be talking about gout and the diagnosis and treatment of gout. I don't have anything to disclose. is a picture of one of the main affected joints in gout, and it pretty much describes how this feels. And once again, another picture that is worth 1,000 words. It's a type of inflammatory arthritis that causes sudden attacks of intense pain, swelling, and redness. 2 out of 100 people, about 2%, are affected. It occurs in joints as well as soft tissues. And the first attack is often in the big toe. This could be referred to as podagra. And I apologize, I came down with laryngitis over the weekend, so this is not how I normally talk. It's a monosodium urate crystal deposition disorder, so that's kind of a big word. Basically, primary gout, idiopathic disorder of nucleic acid metabolism, basically the breakdown products of DNA. This leads to hyperuricemia, too much uric acid in the bloodstream that leaves the bloodstream and is deposited as crystals from this purine breakdown product. And secondary gout is associated with diseases of metabolic turnover, where your body's really revved up, building things up, breaking things down. Psoriasis, hemolytic anemia, leukemia, and chemotherapy. So too much uric acid accumulates again in the bloodstream and leaves the bloodstream, deposits in tissues and joints. These are spike-like microscopic crystals. At this point, the white blood cells in your body travel to these areas and try to fight these crystals, and this is what causes the inflammation. These attacks can last from 3 to 10 days at a time. Common tissues that are affected, again, joints. When you present to the emergency room or to a doctor's office and you have a big red swollen joint, a lot of times people think this is an infected joint. This may need surgery, a washout to rid your body of the infection. But another thing on the differential diagnosis is gout. So typically we will aspirate the joint, pull the fluid off, and send it to the lab. We run lots of different tests in the lab on that fluid, and some things you'll find in there is lots of white blood cells. You may find some crystals. And there's different parameters, different numbers we look at to decide, is this gout? Is this infection? Is this normal fluid? Sometimes the picture's cloudy. And you'll have elevated white blood cells and crystals at the same time. So the point is, just because there's crystals in the fluid does not mean it's not an infected joint. You could have both at the same time. And the big deal that you would miss is the infection. If there is an infection, that's a surgical emergency that needs to go to the operating room and be washed out, whether there's crystals or not. Typically, gout itself is treated medically. So, you find these crystals in the joints. You can find them in the bursa, on the back of the elbow, on the front of the knee. You can find them in the tendon sheaths. You have these tendons that are attached to muscles, and a lot of these tendons run in these little caverns that lets them glide easily, and these tendon sheaths surround these tendons, and you can have these crystal depositions in there. You can have them in the kidneys, and they can form renal stones, and they can actually damage the kidneys. 15% of patients who have gout and gouty attacks can develop these renal stones. These attacks can be separated by months or years. You can have just one attack, or you can have multiple ones in a year. If you're not taking preventative medications, the next attack typically occurs within the next 2 years. And as the attacks continue to happen, the later attacks tend to be more frequent, more severe, and they affect more than just that one joint that you may have presented with. On chronic gout, you have this high uric acid over a long period of time causing the deposition of the crystals in the joints and soft tissues. These can lead to tophi, which are basically white chalky deposits that look like toothpaste that are in the joints and the soft tissue surrounding the joints. They can cause visible lumps up under the skin. Here's some pictures of a finger up here on the top left corner. You can kind of see the little bulging white structures up under the skin. On the elbow, on the bottom left-hand side, again, these can create draining sinus tracts. So you may have gout that's caused the skin to rupture and causes a secondary infection. These also happen on the helix of the ear, as you can see in the picture to the right. With chronic gout, progression is over time and over the years. Joints may develop permanent damage and deformity, pain, breakdown of the bone as it invades the bone. However, when you properly treat these with medication, you usually can avoid the operating room, and these typically will not progress. The picture of joint erosion on the picture to the left. Let's see if I can use this here. There we go. You can see the bony erosion in the great toe and in the middle picture here as well. The cause of this gout, again, is increased production or problems getting rid of it or trouble eliminating the uric acid. This causes hyperuricemia. The uric acid is produced, again, with breakdown of the purines. Normally, uric acid, it's a good thing. It's a breakdown product, a powerful antioxidant that does not cause damage, but the problem is when there's too much of it in your body. It's possible to have too much uric acid in your bloodstream and not ever develop gout. Okay, so if you drew labs on everybody in here, some people in here may have elevated uric acid and not have ever presented with gout. But 2/3 of the time, with elevated uric acid, they never have gout attacks. The risk factors, gender and age, it's more common in young men, the 30 to 45-year-old range, and women after menopause. If you have a family history, you're at increased risk to develop gout and medical problems such as hypertension, diabetes, or chronic kidney disease. Medications can help the onset of gout with diuretics, aspirin or cyclosporin, and then if you have a different lifestyle challenges, overweight or too much alcohol intake. Symptoms. This is a picture of a knee to the upper right-hand corner. When that presents to the office, my first thought is this may be an infection. We need to draw some fluid off and see what's going on. We send the fluid off. It may come back with elevated white blood cells that signify an injection. You need to go to the operating room. But also, it could come back with not as many white blood cells, but a lot of crystals. In that case, we can treat it medically for a period of time. The initiating symptoms may wake you up at night, especially, again, pain in your big toe. It's painful to have it even touched by a light sheet resting on the skin. People can't tolerate that very well. The joint is usually warm, red, and swollen. And if there's a fever associated with it, that's typically not gout. That's typically an infection and typically needs immediate treatment. People who are diabetic, again, may present with gout that turns into an infection with these draining sinuses. When we are looking to find out if this is gout or not, we measure the uric acid level in the blood. Again, it may be normal, even in acute attack, because it's a blood test. When you check the blood for uric acid, that uric acid may have already left the bloodstream and deposited in the tissue. So you may have a gout attack with normal uric acid levels in the blood. It's best to check those levels in between gouty attacks because that will indicate whether or not you pretty much live with an elevated level of uric acid. And again, people with hyperuricemia or elevated uric acid may never develop gout. The synovial fluid analysis, the joint fluid that we draw off, is aspirated from the inflamed joint and causes increased fluid production. This makes it easy to drain the fluid off since there's an increased level of this. And again, white blood cells and crystals are present. The crystals are thin, tapered, needle-shaped, and there's different crystals you can actually get. These specifically are negatively birefringent, and I have a picture of these. These are somewhat clumped together, and these are the needles that you can see under the microscope. As far as treatment goes, our goals are to relieve pain, prevent future attacks, and reduce the risk of the tophi or permanent damage, especially eroding through the skin and bony structure. For an acute attack, we start off with the home remedies: ice, elevation, rest, over-the-counter ibuprofen, naproxen sodium. And then once you present to the physician, we can do other things such as indomethacin, which is a stronger anti-inflammatory, colchicine, or corticosteroids. Prevention is the mainstay. We use medications to lower the uric acid below 6 milligrams per deciliter. If you already have tophi present, we like to bring it down a little lower, below 5. The long-term meds for gout are indicated when there's more than one gout attack per year, when there's severe or disabling attacks, when gouty arthritis is already present and it could progress, if you have tophi or kidney damage or renal stones. The available medications used for prevention: allopurinol, this helps reduce the uric acid production; colchicine, is used to prevent white blood cells from actually attacking the gout crystals, can be used for acute attacks or chronic issues. Probenecide increases the kidney filtration, helps eliminate the uric acid from the blood. And then the newer drug, febuxostat, lowers uric acid levels for those who cannot tolerate allopurinol, and this is a more expensive medication. Prevention, lifestyle changes, exercise and diet. We hear that about a lot of things. Drink plenty of water, lower your caloric intake, especially the calories that come from fat. Avoid sugary drinks, avoid alcohol, eat complex carbohydrates and proteins from low-fat dairy products. Surgical options. When it comes to this, the destructive arthritis is present. Surgery may be needed. This is the tophus. It looks like toothpaste. It's up under the skin. It's in the joint. We open this up and remove it and wash the area out. These can obviously cause the infected sinuses as they erode through the skin, so we like to clean this out before it comes to that. When the joints are starting to be destroyed and you have pain with movement, fingers, wrist, toe, knee, joint fusion may be an option in some of the smaller joints where we actually cause the joint to grow together into one bone. That way there's no movement at all, and that does not cause pain. Obviously, you lose movement with that. Joint replacement around the knee, hip, elbow. We can do a total knee arthroplasty where we replace the joint with metal and plastic. This provides pain relief, does allow you to continue to move the joint. Obviously, the knee is most common in this picture to the right. Thank you so much for your time.
Yeah, I'm not a MD or a PhD or any of that, but education is education, and a lot of this information that was the what you just saw was the clinical aspect, and educational aspects deals with gout. You're going to be talking about P.A.I.R. Okay, you hear people saying it's got upbuild of P.A.I.R., and a lot of people don't know what P.A.I.R. are. You know, you got a lot of nurses here in the building, and even the nurses, you know, you want to know what P.A.I.R. are. The P.A.I.R. are 20 amino acids that the body makes up normally, and then the 20 amino acids are broken down from foods. It adds in something called purines and pyrimidines. Purines are something that we deal with. It's going to be adenine and guanine. And, you know, the nurses and everybody who's been to school, this is just basic science. When you talk about purines, that goes in and said purine metabolism is called metabolism breakdown, okay? Catabolism. And that just goes in and breaks down, and it goes through the system. When it's in the system, and it's talking about gout, it starts to let you know fructose, and then, like I said, the nurses will know a lot more, and you guys can break it down in simpler terms. Fructose breaks down to fructose 1-phosphate. Fructose 1-phosphate breaks down to what's called lactase, okay? And if you have too much lactase in the body, it forms urate, right? Uric acid, you can call it. Uric acid builds up in the body, and that's what forms these deposits in your joints, outside the joints. They call soft tissue. Everything is tissues, because all tissues are made up of what you say proteins. So this is just basic education, which you've made, well, I did in high school, medical school, and regular school. And that just lets you know when you're dealing with gout, it has certain kind of ways to present itself. Because like she said before, there's over 100 different types of arthritis. Some different dealing with gout. And the gout itself, this breakdown of fructose lets you know that this can be very painful. And you know, stress, and some of the things that we talked about earlier, stress, food, things that you eat, your diet, which Dr. Dooley was just mentioning to your diet, and alcohol. These things form a amount of fat, and if you form the fat, guess what? You form a certain amount of uric acid. If uric acid starts to increase in your body, uric acid can have some type of uric acid, what they call uricemia, okay? Uricemia in the blood, you can have uricemia in the blood and never get gout. But uricemia just lets you know you have a certain amount of uric acid that's in your blood that can always be tested, okay? And most of the nurses going to understand what that means, because they come in and aspirate. Aspirate just means you pull out the information that's in the joints and allow you to let them know and to prevent saying this is gout. That's the only way to prevent or let them know that this is what you have, okay? And this is basic science. And that's why, you know, some of the food that you eat, like some people like shellfish, different types of fish, these things have a bit of fat in it. These fats go back and form fructose. Fructose 1-phosphate. Fructose 1-phosphate forms lactase. Lactase itself forms back and forth and makes what? Uric acid. Yes. So if you can do that, when you form the uric acid, it'll let you know then you have an opportunity, you have the ability to have gout. That don't say you have gout, and some people have this certain amount, I think it's between 10. Women are a little bit different from men, okay? Men, after, they can have it in a young age and up to 35 to 45. Women usually don't have gout until after menopause. But that's when the body starts to break down certain things, and they have a certain amount of proteins, which is just hormones, okay? And it changes the way women are going to produce in their body and the way it's going to be excreted, okay? Anybody have any questions on the educational form, not on the clinical form? Because I think that's what all we focus on this is of gout, because gout is there's so many different types of arthritis that we'll be going over, and just knowing the educational portion of it means a lot for what we're trying to accomplish here with arthritis. And I'll just, if no questions on the educational portion, I'll let Ms. Falanda handle the rest of it.
Did y'all learn something about gout? Yeah. Just kind of reiterate on that, talking about women. Y'all know when menopause hit, everything else starts, and women, everything else starts failing. So that's why I guess I always heard my mom and my grandma say, just wait till you get in menopause. I'm still waiting, but I pray it's still a long ways off, because they say everything started failing after that. So I think right now we are on schedule. Our next speaker, she will be pulling up shortly, but at this time, according to your agenda, it says break time.